You have many different options when you're missing a tooth. You can replace a tooth with a fixed bridge, a dental implant, or a removable prosthetic. The dental implant is the closest thing to a natural-born tooth. The implant itself is the root of a tooth based in titanium that is inserted in the jawbone. Once that fuses to the jawbone, that is your solid foundation, at which time your dentist will make you a prosthetic crown that actually screws inside the dental implant. Now you have essentially a real tooth. You can eat whatever you want, you brush it as a normal tooth, floss around it, and we expect that dental implant to be there a long time, if not forever. To see if you're a candidate for a dental implant, at the consultation time we'll do a 3D cone beam CT scan, which will show us the bone volume and the structures within your jawbone. We'll be able to safely plan your dental implant procedure to maximize the aesthetics, form, and function, and work closely with your general dentist so you have the best predictable outcome. The benefit of a dental implant is it's treated as a real tooth. You keep a one-tooth problem a one-tooth problem. So you don't prepare or adjust the adjacent teeth. There's no risk to your adjacent teeth, and you can clean around it as you would a normal tooth. A dental implant will restore you to full form and function. You can eat whatever you ate before. In fact, the dental implant may be stronger than some of your natural teeth.